Today we're going to talk about a crucial topic that affects many people without them even realizing it. The signs that your body is desperate for vitamin B12. The first sign we'll discuss is something a lot of us might just brush off: fatigue and weakness.
Oh, I always thought feeling tired was just part of a busy life. How does this relate to vitamin B12 specifically?
That's a common assumption, Sarah. However, fatigue and weakness can be especially pronounced when there's a B12 deficiency, because this vitamin is essential for producing red blood cells, which carry oxygen throughout your body. When you're low on B12, your body isn't making enough healthy red blood cells, leading to a condition known as anemia, and that's when you start feeling that persistent tiredness.
So it's like running a car without enough fuel?
Exactly. Imagine trying to drive up a hill with just a drop of petrol. That's how your body feels when it's low on B12, like it's always trying to operate without enough energy.
That must be really tough. Is there a specific example that can help us understand this better?
Certainly. Let's say a college student like yourself is preparing for finals but feels constantly tired and unable to concentrate. Despite sleeping well and eating what seems like a balanced diet, they might still experience these symptoms due to low B12 levels, particularly if their diet lacks adequate sources like meat or dairy products.
I see, so anyone could be at risk if their diet isn't balanced. How do people usually realize they need more B12? Is it just by noticing fatigue?
Often it starts with the fatigue, yes, but it can also be identified through routine blood tests if you discuss these symptoms with a healthcare provider. They might notice a lower than normal red blood cell count or signs of anemia, which would prompt a deeper look into your B12 levels.
Got it. It sounds like keeping an eye on how you feel physically can really help catch this early. Thanks for explaining that, Dr. Mike.
Absolutely, Sarah. Monitoring how you feel can be key to addressing many health issues before they become severe. Remember, fatigue from B12 deficiency is persistent and more than just feeling tired after a busy day. It's about feeling weak and exhausted nearly all the time without a clear cause. Moving on to the second alarming sign of vitamin B12 deficiency: nerve issues. This includes symptoms like tingling, numbness, or a pins and needles sensation, especially in the hands and feet.
That sounds pretty scary. Why does that happen?
It's quite concerning indeed. Vitamin B12 plays a crucial role in the maintenance of the myelin sheath, which is like the protective coating around your nerves. Without enough B12, this sheath can deteriorate, leading to nerve damage. This damage is what causes those tingling sensations or numbness.
Is this like when your leg falls asleep?
In a way, yes, but more persistent and troubling. When your leg falls asleep, it's usually due to temporary pressure on the nerves. With B12 deficiency, the problem is more internal and can lead to long-term damage if not addressed.
So, how would someone know if it's just their leg falling asleep or something more serious like a B12 issue?
Great question, Sarah. It comes down to the duration and frequency of symptoms. If the tingling or numbness is frequent, occurs without an obvious cause like sitting in one position too long, and especially if it's accompanied by other signs of B12 deficiency we discussed, it might be time to consult a healthcare provider.
Are there specific examples of how this might affect someone's day-to-day life?
Absolutely. Consider someone who works at a computer all day and starts experiencing these symptoms. They might think it's just due to their posture or wrist positioning. However, if the symptoms persist despite changes in their workspace ergonomics, B12 deficiency could be the underlying issue. It's important not to dismiss these symptoms because early intervention can prevent further nerve damage.
That makes sense. I guess it's really important to pay attention to what your body is telling you.
Exactly, Sarah. Listening to your body and recognizing these signs early can make a significant difference in managing and treating B12 deficiency effectively. The third sign your body might be desperate for vitamin B12 is memory problems. Many people don't realize that a deficiency in this vitamin can lead to cognitive issues like memory lapses, difficulty concentrating, and confusion.
Wow, I wouldn't have thought that. How does a vitamin affect your memory?
Vitamin B12 is vital for brain health. It helps maintain the health of nerve cells and aids in the production of DNA and red blood cells. Without enough B12, your brain's ability to function properly is impaired because the nerves aren't being protected as effectively. This results in those memory and concentration problems.
That must be frustrating. Can you give me an example of how this might show up?
Sure. Take someone who has always been sharp and quick with numbers, but suddenly finds themselves forgetting simple calculations or struggling to remember daily tasks like where they put their keys. These lapses in memory or difficulty focusing could be mistaken for general forgetfulness or aging, but when combined with other symptoms of B12 deficiency, they're a red flag that your brain isn't getting the nutrients it needs.
That's scary. So people might think they're just being forgetful when it's actually something more serious.
Exactly. It's common for people to brush it off, attributing memory issues to stress or getting older. However, when this fogginess is combined with other symptoms like fatigue or nerve issues, it's worth checking your vitamin B12 levels. The good news is that with treatment, many people find that their cognitive function improves significantly.
I see. So if someone starts noticing these problems along with other symptoms, it's important to consult a healthcare provider.
Absolutely, Sarah. Being proactive can make a huge difference, as early detection and treatment can often reverse the cognitive decline associated with B12 deficiency. The fourth sign that your body may be desperate for vitamin B12 is mood changes. Low B12 levels can cause depression, irritability, and mood swings due to the vitamin's crucial role in neurotransmitter function.
That sounds like something that could affect anyone's life deeply. How does vitamin B12 tie into our mood?
Vitamin B12 is essential for synthesizing neurotransmitters like serotonin and dopamine, which are chemicals that regulate your mood. When your body is low on B12, the production of these mood-stabilizing chemicals is affected, often leading to increased irritability, depression, or unexplained mood swings.
So if someone is experiencing these mood swings or feeling down, could it be due to a B12 deficiency?
Yes, it's possible. For instance, consider someone who feels increasingly depressed and irritable over time. They may initially attribute these changes to stress at work or personal problems. However, if this persists and is accompanied by other symptoms of B12 deficiency, it's worth investigating further.
It's like when you're feeling off emotionally for no clear reason.
Exactly. That feeling could point to something more than just daily stress. Vitamin B12 deficiency often gets overlooked as a cause for mood disorders because the symptoms can overlap with other issues. However, it's crucial to identify because B12 deficiency is treatable, and many people notice their mood stabilizing after they start supplementation or adjust their diet.
That makes a lot of sense. So if someone experiences these kinds of mood swings, especially combined with the other signs, they should check their B12 levels.
Right, Sarah. A healthcare provider can run simple blood tests to confirm B12 levels, and from there, appropriate treatment can be planned. Your mental health matters, and correcting a deficiency can make a significant difference. The final sign of vitamin B12 deficiency that we'll discuss today is pale or jaundiced skin. When B12 levels are low, the body struggles to produce enough healthy red blood cells, which can lead to anemia and a pale complexion. In some cases, the skin may even appear yellowish due to a buildup of bilirubin, a waste product released when red blood cells break down.
That's quite alarming. What exactly causes this change in skin color?
It's related to the impact of B12 deficiency on red blood cell production. Without enough vitamin B12, your body can't make healthy red blood cells efficiently, which results in fewer cells overall. This reduction leads to paleness because your blood is not adequately oxygenated. Additionally, the existing red blood cells can become fragile and break down more easily, releasing bilirubin into your system, which can then cause jaundice.
So if someone's skin starts looking unusually pale or yellowish, they should be concerned about their B12 levels?
Absolutely. If you or someone you know notices these changes, particularly if they're accompanied by other symptoms like fatigue or nerve issues, it's wise to consult a healthcare provider. They can identify if a B12 deficiency or another underlying condition is at play.
I imagine this might be tricky to notice if someone has a naturally light complexion.
That's true, which is why it's essential to be aware of the other signs as well. Pale or jaundiced skin is one potential indicator, but combined with memory problems, fatigue, nerve issues, and mood changes, it can strongly suggest a vitamin B12 deficiency.
Thank you so much for explaining all these signs, Dr. Mike. I've learned a lot, and I'll be more aware of these symptoms in myself and others.
I'm glad you found it helpful, Sarah. Understanding these signs is the first step to ensuring proper health. If you or anyone you know notices these symptoms, make sure to seek advice from a healthcare professional. Taking care of your vitamin B12 levels can lead to significant improvements in your overall well-being.